Sawadee and good afternoon. Thank you for tuning in today to our weekly English language briefings from the Center for COVID Situation Administration, or CCSA. Today is Monday, the 21st of February 2022, and this is the first of our regular 2 English language briefings for our English language audiences this week, noting, of course, that we may also add additional briefings if necessary. In any event, our second briefing for this week is scheduled for Wednesday, the 23rd of February 2022 at the same time, directly after the general CCSA meeting that will be chaired by the Prime Minister. As you know, last Thursday's briefings, both Thai and English, were cancelled, but please rest assured that my team consistently and regularly monitors all important developments, whether or not we go on air. And the various working groups under the CCSA certainly continue to do their work, so we will make sure to include any and all important updates for you in the following briefing. So let me turn now right away to a summary of notable points raised just now in the Thai briefing for you. The CCSA meeting this morning continued to monitor the global COVID situation, the overall trend globally reflecting that new cases of infections are on a downward trend, with some countries, however, being a notable exception. The fatality rate, in any case, at the global level remains stable. Many of the countries that are relaxing most, but not all, of their COVID prevention measures have thankfully passed their latest Omicron peak. In Thailand, however, we are not there yet, as we are witnessing every day higher numbers of infections. In Asia, in fact, and a number of countries were mentioned this morning, such as the ROK, Republic of Korea, and others, that trend is upwards. So although here at the CCSA there has similarly been a healthy amount of debate, and certainly all the agencies represented at the CCSA are keenly aware of the strong desire to relax many of these measures, the officials are at the same time looking very closely at various predicted scenarios for our domestic situation in terms of when exactly that peak would come. So we will, of course, keep you updated and well informed of any further adjustments on the various COVID prevention measures. So again, for Thailand, the cases of new infections, especially those with severe symptoms, and the fatality rate are all on an increase, with the majority of those being a mix of those over 60 and some unvaccinated. Provinces in the northeast and south of the country have witnessed a worrying trend, with cases of new infections there on an acute rise. Risk factors remain in-group dining at restaurants and other venues, close contact with colleagues and classmates, and large gatherings, including sporting events, funerals, and weddings. New clusters continue to be found in schools and as well in markets, with the latter found in smaller clusters. Risk factors for markets and restaurants can be attributable mainly to a failure to comply with universal prevention and COVID-free setting measures. ATK first and home isolation first remain the go-to method for dealing with the current Omicron-led wave. Let's turn now to the usual slide that we have up for audiences at home to have a look at the general situation in the country. And we have new confirmed cases today through PCR testing only, logging in at 18,883 cases. That brings our total accumulated number up to 2 million and a little over 700,000 cases. The majority are being found within the age group of 18 to 59 years, and that was mentioned in the Thai briefing. And for today, let me just bring your attention to some other figures that would be useful to pay attention to, which are the number of those in critical condition, and you have there 796 which are in critical condition, out of the 166,397 active cases. Within that number, there are 202 on ventilators. New recoveries, a high number there, 14,914, and new fatalities, unfortunately still logging those at a low number, however, of 32. The percentage of the accumulated total of infections for new fatalities and all fatalities remains at 0.83%. That is still, fortunately, a relatively low number. Let's take a look now at entry into Thailand, which was reported on just now as well. Since the beginning of this month, the Thailand Pass system has received a total of 274,722 applications, of which 215,456 have duly been approved. There are remaining 6,106 applications under review. Some good news to note here is that the list of approved vaccines for the Sandbox scheme has been updated to include 10 vaccines, the latest one being Medigen and Sputnik Light. The latter, of course, was added on the 10th of February for those who are following that closely and has been effective since then. Those vaccinated with Sputnik Light are still not eligible for the Test and Go scheme for the time being, but as I mentioned earlier, these have been added for the Sandbox scheme. As you may have been following on various media outlets, a fake email claiming to be an email from Thailand Pass was circulating last week. And let me have that on screen for you to see what that looks like for those who were not aware. Warnings not to open that email were also circulated immediately once this was discovered. Thankfully, upon further investigation, many of those who received this fake email were from a group that had already returned home from their trip to Thailand and did not click on the attachment. Rest assured, the Thailand Pass system remains intact, and we have continued to raise the security levels on the system and will continue to make important adjustments. Let's now take a look at the number of vaccines that have been administered for the month of February 2021 for our usual updates. And that slide will come up for you fairly soon. Yesterday, on the 20th of February 2021, we administered 141,661 doses of the vaccine, which increases the accumulated number of vaccinations to 121 million doses. The total number of people who have received their first dose, therefore, now stands at 53,126,900, or 76.4% of the total population, while those having received their second dose stands at 49,471,890 vaccines, or 71.1% of the total population. Those having received the booster dose is at 19 million, a little over 19 million there, representing 27.5% of the total population. The Ministry of Public Health is now giving priority to two main target groups to receive vaccinations, which includes, firstly, the elderly aged over 60, accounting for 12.7 million people of the population, of which 82.7% have already received at least one dose of vaccination. The second group they are targeting is the group of children aged 5 to 11 years old, which accounts for 5.1 million people of the total population, of which 7.7% have received already at least one dose of vaccination. With an aim now to increase the number of booster doses administered among the Thai and foreign populations, the Bang Sue Central Vaccination Center is now open to provide booster doses of the COVID-19 vaccine, or that third dose, from 17th of February 2022 onwards at entrances 2 and 3 from 0900 hours to 1600 hours. Walk-in, of course, is available, and you have that slide on screen for you to take a note of the important information, which I will run through very quickly. And that is that those who are eligible for this third dose includes 3 groups. The first being those who have had the second dose of Sinovac or Sinopharm at least 30 days before. The second group are those who have had the second dose of AstraZeneca, or Sinovac, Sinopharm to AstraZeneca, or Sinovac, Sinopharm to Pfizer, or Sinovac, Sinopharm to Moderna at least 90 days before. And that last group there is those who have had the second dose of Pfizer to Pfizer or AstraZeneca to Pfizer at least 180 days before. I'm sure you can find that infographic on the Public Relations Department website if you did not have an opportunity to jot that down at this briefing. For adults who wish to get their 4th dose and children age 5 to 11 who want to get a first or second dose, you can register through the Thai mobile network. In addition, there has also been a focus currently, as was mentioned by the Deputy Prime Minister and Public Health Minister, Anutin, on managing the amount of beds and preparing enough medicines and medical supplies for the current situation. Again, home isolation is also being encouraged and highly recommended to ensure that hospital beds are available for those with severe symptoms. The minister has also said that additional community isolation centers are being set up in Bangkok, while other provinces have been accommodated by field hospitals. Also recently, Dr. Gietipoom, who is the Permanent Secretary of the Ministry of Public Health, has meanwhile recently addressed allegations about the risks of side effects in administering Sinovac's COVID vaccine to children during a recent press conference. It was clarified there that the use approval for the vaccine in children was based on academic information and research, and that the injections are certainly voluntary. The Permanent Secretary also assured the safety and effectiveness of cross-vaccination formulas, particularly for the Sinovac Pfizer formula. Another bit of news that I would like to share with our English language audiences today before we wrap up is that a 51 billion baht loan proposal was recently approved to help cover reimbursement claims for COVID-related services. And this during a National Health Security Office NHSO meeting that was headed by Deputy Prime Minister and Public Health Minister Anutin on the 7th of February. The NHSO board here agreed to secure a loan to help pay reimbursement claims filed from December 2021 to September 2022. The 51 billion baht loan will be divided into 2 parts, with 34.52 billion baht set aside for the first phase that runs from December 2021 to February 2022. And the remaining 16.53 billion baht will meanwhile be set aside for the second phase, which will run from March to September of 2022. Again, the first phase covers COVID-19 service costs, which will be calculated based on real payment expenses processed during the December-January period, while costs in February are calculated based on real expenses and the average number of patients since April 2021. The NHSO for that second phase will also set aside a budget within this total of 9.69 billion baht, which will be directed for health promotion and COVID-19 prevention, patients' medical expenses, and vaccination and service compensation. That is all I have for today. Just a friendly reminder to our English language audiences at home that as the new cases of Omicron-led infection is on the rise, please continue to follow universal prevention guidelines to keep you and your loved ones healthy and safe. And please do get vaccinated if you are in a position to do so. Stay safe, have a good week, and we will see you again on Wednesday after the CCSA General Meeting chaired by the Prime Minister. Thank you and สวัสดีค่ะ